Good morning. Myself Varun Kumar, faculty, Sns College of Physiotherapy. Today we will discuss about a topic called stretching. So stretching. In this class, we will see about the definition, purpose of the stretching, indications, and then the contraindications. So definition: the stretching is a therapeutic maneuver in which a muscle, tendon, unit, or other soft tissues are elongated with the goal of increasing the flexibility, range of motion, and reducing the stiffness. So the purpose of stretching is to increase the soft tissue extensibility and to restore the normal muscle length, to correct the muscle imbalance, to prevent contractures, to improve the functional mobility, to reduce the risk of injury, to relieve the muscle soreness and tension, to prepare the body for activity. So the main purpose of the stretching is to elongate the soft tissues or the elongation of the muscle fibers. It can be either used for the diseases, neurological diseases, where the stiffness will be major role play in the neurological patients, so we can reduce the stiffness by means of the stretching the particular muscles. So the indication. So the indications of the stretching, which the stretching can be given. So mainly for the patients with muscle tightness, the patient with who is having a reduced range of motion, patient who have the post immobilization stiffness, patient having the contractures, who is adaptive shortening due to the posture, the sports warm up, and then muscle imbalances or pain due to soft tissue tightness. So these are the cases where the stretching can be involved. So contraindication. So in these followed conditions, the stretching should be avoided. Whereas the contraindications like the recent fracture, acute inflammation, acute muscle or tendon tear, hematoma, bony blocking, which limiting the range of motion, unstable joint, after any recent surgery, and then severe osteoporosis and sharp pain during the stretches. So the physiology of the stretching. So the physiological changes in muscle during the stretch, where the lengthening of the sarcomeres, and then there will be a decrease in the passive tension of the muscle, and also there will be a viscoelastic properties like creep and stress relaxation, and the plastic deformation if stretch is held long enough. So the neurological changes in the muscle. The neurological changes in the muscle involves muscle spindle, which resists the rapid stretch. So the reason ballistic stretching can be unsafe. Then Golgi tendon organ. So Golgi tendon organ activated by sustained stretch, which causes the reflex inhibition, and thus the muscle is getting relaxed. Next is the autogenic inhibition. So autogenic inhibition is applied by means of the relaxation of the same muscle that is being stretched. Then a reciprocal inhibition, where the contraction of the agonist inhibits, whereas the antagonist is used for the PNF. In autogenic, the same muscle is being relaxed, whereas in reciprocal, the agonist and antagonist muscle both are being involved. So then types of stretching. So the types of stretching involves passive stretching, self-stretching. In passive stretching, the therapist or external force produces the stretch. There won't be any active muscle contraction, and it is usually in the conditions like contractures, post-immobilization, neurological conditions. So the passive stretching, the name itself denoting that it's a passive. So it can be done by either by the therapist or by the external force. Then active or self-stretching. So it in the name term itself that the patient can be do the stretching by themselves. So the patient performs movement to elongate the muscles, and it is usually in the home exercise program, and also it is safer and it is used for the long term flexibility. Then next type of stretching is the PNF stretching, where there is a proprioceptive neuromuscular facilitation. So the name itself denoting that it can be used for the facilitation of the muscle followed by any neuromuscular conditions. So that this PNF involves combination of the stretch with muscle contract techniques, where the techniques involve hold relax technique, contract relax technique, agonist contraction alone, and then the hold relax with agonist contraction. Next type of stretching is the ballistic stretching. So it is the repetitive bouncing movement, and it activates the muscle spindle and reduces the risk of injury. And it is used only for well-trained athletes, never in the rehabilitation purpose. So the principles of stretching. So to warm up the tissues before stretching by means of a hot pack or aerobic warm-up. Then move to the point of mild discomfort, which where the patient should not feel the pain, and hold the stretching for the 15 to 30 seconds. It is a static one. Then 60 seconds for the chronic tightness. Repeat this for the 3 to 5 times. Slow and controlled movements. Stabilize the proximal segment. Avoid the compensatory movement. Breath control. No breath holding. And then the stretch the both sides symmetrically. So in class assessment, it is used for the evaluating the students where the condition is being memorized or it is understanding for student or not. So the mind map involved The stretching where there will be an introduction, then there will be a purpose, and then there will be any indication or contraindication.